My name is Biernacki, and I'm going to give you tips specifically for you how to get better the fastest possible way in your bunion surgery. So, surgery is a big deal. I'm going to guide you all the way through it from start to end, and other things you could do, possibly even avoiding surgery altogether. So it's before the surgery. What kind of things can you do to get ready for your bunion surgery? So number one, the healthier you are, the better you're gonna heal. So it goes back to that Abraham Lincoln saying, if you had a few hours to chop down a tree, what do you do first? You spend most of that time sharpening the axe. That's what you wanna do to get ready for your bunion surgery. So what does that include? That includes eating healthy. If you smoke, stop smoking. Lose weight ahead of time. For every 1 pound you lose, it's been said that it takes about 3 to 4 pounds off your knees and your feet. That's a massive amount. That really helps with healing. So what that means is if you're a healthy, fit person, that type of person is gonna recover very quickly from surgery compared to someone who has a hard time staying off of it, who carries a lot of weight and has lots of back, knee, hip problems. But at the same time, I know that's what's probably making you want to get the surgery in the first place. So eat healthy, stop smoking, get as flexible as possible. It even makes sense to sometimes see physical therapy well ahead of time. Learn how to use your crutches ahead of time, your knee scooter, learn all that stuff, and you are gonna do amazing after your surgery. That's before surgery. The day of the surgery, here's what happens as you're getting worked up for this by your podiatrist or your foot specialist is we're gonna make sure you have no health issues. If you're otherwise healthy, most of the time anesthesia includes something called sedation anesthesia with a block for your foot. So that's like going to the dentist and getting your tooth numbed, except this time we're numbing your foot, plus we're working with an anesthesiologist to get you fairly healthy and in good shape after the surgery. Bounce back pretty quickly, but you stay numb for up to 24 hours or sometimes more depending on the anesthesia given. So the actual surgery is usually an outpatient procedure. That means that what's gonna happen is you go in there about an hour and a half before. The surgery takes about an hour to 2 hours to get done, and then you go home. Most of the time, you could even be walking. You wake up from your anesthesia with your foot numb, ideally not in a lot of pain, but your podiatrist or foot specialist will then give you some pain medication, some possible anticoagulation medication like an aspirin or something stronger depending on the type of surgery. And at the same time, if it was a long procedure, you might get some type of antibiotic before and after the surgery. So when you go home, at that point, you have a dressing on. When you wake up from the surgery, you use crutches, you use a knee scooter, whatever you and your doctor have decided is best for you to go home with. And then ideally you go home and your foot should be numb and you go to sleep, but depending on the anesthesia, you may have some pain and need to take some pain medication well ahead of time. This includes stronger narcotic-like medications, and for some people, anti-inflammatories combined with this can work great. So our main goal is to keep you pain-free during this time. What type of surgery did you have? There's about 4 main classes of surgeries, depending on how you define them. One is called an exhaustectomy or chylectomy. This is just shaving the bump. This is the fastest possible recovery time. This means you're basically walking with a dressing almost immediately, and once your stitches and your incision site heal over a couple of weeks, you're pretty much right back at it. Number 2 is an osteotomy. So an osteotomy, this is your chevron or your Austin 2-screw bunion. So this is for smaller bunion deformities to correct the bump. This works great and you can be moving right away. The main problem with this one is if you do have a severe bunion deformity, it's not enough to correct it. And sometimes some studies have shown that over 5, 10, 20 years, you can get a little bit more recurrence. But again, it depends what life situation you're on. So talk with your foot specialist about this. Another one is an implant. This can range quite a bit. Depending on your situation, implant, you could be walking a little bit earlier, or they could want you to stay off of it. It depends on your specific situation. But implants can work well to maintain motion. They're somewhere in the middle. You're usually not going full blast right away, but you aren't really for any surgery, but you're not off of it as long as some of the bigger surgeries. So fourth, the last type of bunion type procedure or big toe joint procedure is a fusion in the big toe joint or in the midfoot area. These types of procedures will probably be a little bit more sore at the beginning. You might need something called a popliteal block for some more pain relief, and you might need to be off your foot for probably at least a few weeks. You might be in a cast or a splint at the beginning. I know we do that for a lot of our patients to keep them nice and comfortable, and mostly to prevent you from injuring yourselves, because the majority of postoperative problems are from people somehow agitating or irritating their foot. So we want to protect you and make sure that you're very comfortable and have no pain. So it's the day after surgery. What happens now? Well, stitches stay in, depending on if they're reabsorbable or not, they stay in for roughly 2 to 3 weeks, depending on what type of procedure you have done. I like to keep the dressing on for about 2 to 3 weeks. This is what a lot of studies show to be very beneficial and effective for surgeries like this. But then next, as about a week or two go by, you come back in a week, we make sure that there's no problems. You usually don't need a lot of pain medication in most cases after this, depending on the surgery. An x-ray's taken, and we change the dressing or the cast, and then we wait about another week or two. So this is now the second visit. This is about 2 to 3 weeks after your surgery. Usually you come out of your dressing at this point, but again, varies on the type of surgery because there's many different types. At this point, you can move back into a shoe or a shoe with a brace, and sometimes more of a walking cast or boot, depending on your situation, how you're doing. Like I said, if you're lighter and you're very healthy and you're healing very well, you're probably closer to a shoe, whereas someone who's having a very difficult time might be a little bit more protected at this time. And now it's the third postoperative visit. This is now at like 5-6 weeks. You're usually doing pretty good at moving around. At this point, you go completely back into a good supportive running shoe, and you're still a little bit sore. This is what I call the dark days of foot surgery. This is where people basically stop coming with you, because what happens is at the beginning, it's exciting. Everybody's coming with you. You're getting rides, but now you're kind of annoyed that it's taken forever to heal, and you don't quite have the benefits where it feels better than it did before the surgery. But here's the beauty at this point is, as another month goes by, your foot should start feeling better than it did before the surgery if you had a lot of pain. But here's the main thing to remember. Nothing is wrong with your foot until about 3, 4, 5 months go by and you're not noticing any improvement. Almost everybody, unless something unusual happens, like you fall down the stairs or fall out a window, everybody starts getting better completely by about 4 to 6 months. So to summarize, here is what it takes to get better. By about 2 to 3 weeks, you don't need pain medications. You're kind of up and moving around, but you're not close to 100% where you want to be for at least a few months. I'm talking 3, 4, 5, 6 months in some cases. It depends how ready you are ahead of time for surgery. Physical therapy helps at this time, and it can really get you better. And lastly, can you drive? This is a huge question for people. A lot of the times, the question of can you drive, this really depends on your doctor. Sometimes there's no specific law against how injured your foot can be, but I always try and picture myself if you were to hit a lawyer and he got out with a camera such as this thing right here, what do you think would happen? They start taking pictures of your cast, your shoe. It's not a black and white world. Just be careful. Can you walk through an airport scanner? This is a funny question. Actually, I asked this when I was crossing through the airport once, and they said, we just look at your foot. It doesn't matter that there's metal. That's why you take your shoe off anyway. When should you call your doctor or podiatrist? So this is when you know you should call your doctor. If there's blood coming through your dressing, if you're really, really sore and it's not getting better, if your doctor told you to loosen your dressing and this doesn't help, then you might want to page them or reach out to them. Also, if you slip and fall, if you injure yourself, if it feels like you're having the flu, if you're having issues, there's always a small percentage chance that something like that could happen. So it's better to nip these things early before they become a big problem. Early on, it's not a big deal. The only patients who have a big problem are people who wait a very long time to get a hold of somebody. So what are the success rates? This is all over the board, especially when you watch videos and studies online. Some people say don't ever have surgery. Some people say have surgery a lot. What a lot of the institutions have done, a lot of the surgical institutions, and you can look around at different studies, but generally eyeballing it from my end, it seems like what the objective studies show is about 85% are very happy after about 6 months. About 10% are only somewhat happy. About 5%, so about 5%, just always be aware, are very unhappy. So keep that in mind. It's pretty decent odds. You're about 95% chance you're going to be very happy. In our experience, people who have a harder time getting to the surgery because of numerous health issues and following instructions after the surgeries, that's what makes up that 5%. It's hard to think of a time that somebody who takes great care of themselves and follows instructions really has an issue. It's always those fluke situations where something outrageous happened. But again, you can't guarantee that kind of stuff. This is my biased opinion. But you got to do all that stuff I was talking about to keep safe and healthy. So this has been the video on bunion surgery recovery time. Get as healthy as you can before the surgery. The surgery is usually outpatient. It takes about 3 to 4 weeks to really get back into a good pair of shoes. And then by about 3, 4, 5, 6 months, you're at 100%. And again, this depends mostly on how sore you were before the procedure and how debilitated and how healthy you are in taking care of yourself. So this is Biernacki. I hope I was able to help you, and let me know if you need anything.